Today I'm going to do an Ezpap. So the first thing I'm going to do with any patient, I'm always going to check their charts, and then I'm going to enter the room and introduce myself, and then I'll do the pre-vital signs and listen to their lungs to see kind of what everything sounds like. So here we have an Ezpap. It comes with a disposable pressure manometer, and then we have this one. You have to hook to an oxygen source, so you have to be able to be close to an oxygen source. So I'm going to hook it up to a Thorpe tube, click connect over there. So the first thing I'm going to do is set up the tubing. I'm going to get it connected to here. I'm going to prepare my manometer here. So with this, I would instruct the patient on what we are going to be doing. So with the Ezpap, this is going to help them cough up secretions. This is going to clear out their lungs and hopefully improve their lung sounds and make them feel a lot better than what they have come in. So the first thing here, I'm going to connect here before I place it to the patient. Get it ready. And I place it on 5 liters per minute. And so here you would set this at an appropriate measurement where you'd like them to be at. So I set it at 20, and so we're going to have them do a 1 to 3 or 1 to 4 ratio of breathing in. So taking a nice deep breath in and exhaling. But before we do that, we always place a nose clip on them. Tell them it's going to be a little uncomfortable for a little bit, but it's just so that we know they're only breathing through their mouth and not through their nose. So after you have placed on the nose clip, then you can instruct them, okay, so this is how you're going to do this. So you're going to take a nice deep breath in and then exhale. And so as we do that, we watch the meter. And so here the little red line will go up, and then that's where their rate would be measured at. And with this one you can connect a nebulizer treatment to also. So if they needed a nebulizer treatment, you would close the connection to here. You want to have that on, and you would have a T-piece, and then it'd have a little place for the medication cup to be connected to this piece. And also instruct the patient when holding it, don't hold the back part. As you can hear, it's not going to get the appropriate flow through the machine. And so when we are done, after they are done, we'll have it do it for a few times, and then we'll have them do a nice deep cough and have them cough up any secretions. And if the doctor has ordered to have labs done with the secretions, we'll have a little sample cup and we'll put it in that, or otherwise we'll have a basin for them to cough into if we don't have to have the thing. So with this, we would write down, make sure we chart on what they cough up, what it looks like, the color, smell, how much they coughed up. And then when we are done, so we do this a few times, and we also give them a break. We don't want to overwhelm them with it and cause them to either hyperventilate or even pass out. So when we are done, we will shut this off, remove it from the oxygen source, and then we would remove the manometer. We would dispose of the manometer because this is a disposable pressure manometer, so it can get too much moisture in there and not work properly if we don't dispose of it. And so we'd remove this, and we would take off, like, there'd be a mouthpiece on the end here, and we'd take that off, and we would clean that with sterile water. And then this, we would just make sure it's air dry, and then we would cover the end piece and put that back on, and they can use this again if they are needing another treatment later on, and then we can assist them to help them with this one. And so when we are done, we would take and do the post-vital signs, and then we would also listen to their lungs to see if it's improved their lung sounds, if it's starting to sound better, getting more clear. Then we would chart that down in the patient's chart, and also let the doctor know what we have done for the patient. That way they know they've had a treatment done.